So let's look at this paper, which looked at intramuscular progesterone, whether that optimizes the chances of pregnancy. So it was a randomized controlled trials looking at the effectiveness of different progesterone administration. They looked at progesterone, vaginal progesterone alone, looking at a combination of vaginal progesterone and intramuscular progesterone, and looking at daily progesterone injections. So let's look at this study in more detail. The total number was 1,346 patients. They were randomly assigned to receive either 50 milligram of intramuscular progesterone daily, 200 milligram twice a day of micronized vaginal progesterone, plus 50 milligram of intramuscular progesterone, or 200 milligram twice a day of vaginal micronized progesterone. The outcome was live birth rates and miscarriage rates, and the key findings of this study were that the live birth rates were significantly lower in women receiving only vaginal progesterone, 27%, than in women receiving intramuscular progesterone, that is 44%, or a combination, that is 46%. The miscarriage rates, so 50% of miscarriage occurred in women receiving only vaginal progesterone, and the combination therapy was as good as giving progesterone IM alone. So let's look at the comparison of treatment groups, and you're looking at the intramuscular group, live birth rates of 44%, combination 46%. If you look at the miscarriage rates, highest in the so that's in the vaginal group, highest at 33% in the vaginal only group, and if you see lowest in the intramuscular and the combination group. So what were the key findings of this study? The key findings of the study were that vaginal progesterone resulted in significantly lower live birth rates of 27% compared to intramuscular progesterone of 44 and combination of 46. The combination treatment was non-inferior. The lower birth rate of vaginal progesterone was primarily due to an increased amount of pregnancy loss, especially biochemical loss. If you have a look at the paper which I had reviewed recently, which said that biochemical loss, irrespective of any treatment, seemed to be constant. But here again, they've noticed that vaginal progesterone seemed to give a slightly higher loss. And it seemed from this study that vaginal progesterone may not be adequate. So if you look at patient preferences, certainly I would prefer vaginal progesterone compared to intramuscular, but the 1 in 3 also was some option that patient could take. So what is the limitation of this study? At the end, we have got limited knowledge regarding optimal progesterone levels, preparation, dosage, frequency, and the timing of replacement. If higher doses of vaginal progesterone at 400 milligram twice a day were given, probably we may have got different results, but we don't know about it. If you look from the conclusion of the study, that vaginal progesterone on its own gave a much lower chance of pregnancy, significantly lower live birth rate. The combination treatment of vaginal plus intramuscular progesterone every third day was non-inferior to intramuscular progesterone, giving an alternative approach. And it recommends against using vaginal progesterone alone. Again, it's based only on one study, and I don't think we've been able to reach a conclusive analysis. In my practice, I see to it that I give vaginal with either in a frozen cycle, giving some cutaneous progesterone or adding intramuscular progesterone.